Ladies and gentlemen, we've got to play catch up, but this is a story we wanted to tell you. It's a matter of pride. Lives have been saved, but it's also kudos to a team of doctors who have believed they can. In 90 seconds, they've performed a surgery which is nothing short of a miracle. If the diagram right next to me, you can understand that's what they have done. Inside the womb, they have operated and conducted a heart surgery on a baby which is just 28 weeks old in the womb of a 26-year-old mother. It's a phenomenal achievement that's happened. The entire surgery was completed in 90 seconds, and there is a dilation of the heart which has been done with the balloon. The baby and the mother are safe. In fact, this surgery was conducted a month ago. The doctors actually waited to ensure that what they have done and their efforts have helped save lives, and it has happened. अब ये तो celebration बनता है. It's an AIIMS teams of doctors, Prime Minister Narendra Modi, the Health Minister Mansukh Mandavia. They've all congratulated the team. We said we must bring to the fore and let Hindustan, let Bharat see some of those doctors. So we were hoping to get the entire team, but they've all got respective medical emergencies. One of the doctors, who's a cardio consultant, Dr. Rama, is with us at this point. So he's joined us. Dr. Rama, namaste. Congratulations. First up, thank you very, very much for speaking with us. But to you and your team, congratulations. Can you take us through this case?
Thanks a lot. I think this is we are dealing with a 26-year-old female who was 28 weeks pregnancy, and this was her fourth pregnancy. 2, she had miscarriages, and 1, she had a delivery. The baby died at around 20 days of life. Maybe because of some cardiac lesion, but we don't know the exact details of the cardiac lesion. So something similar to what we found in this was suspected. So this baby also was initially suspected, screened, and then now at this time we realized that the main heart valve that is there, which is known as aortic valve, where the heart pumps blood into the whole body, that is the main valve that controls it, and that valve is not formed well, and it is almost getting closed. And since that was getting closed, then the main chamber, that is the pumping chamber, that is generally goes smaller and smaller. And by the time baby is born, then it develops into a heart where the main pumping chamber is not well formed. So that is what the situation that we were dealing in. So we had an option to do nothing. And then in that case, the baby would have had what is known as a heart which is known as hypoplastic left heart syndrome. That means the main left heart pumping chamber will be small and that cannot be of any use. So then in that case, the child will need 3-stage surgery, and yet the outcomes are going to be till 10 to 15 years only.
Okay.
So we are dealing with a grave situation if you don't do anything. So most of the situations when we see such patients, they generally go for abortions.
Right.
Because the outcomes are so bad. So generally they go for MTP. Since this patient already had a few miscarriages and bad obstetric history, and then they were a kind of a right time where we picked it up, where possibly if we intervene, there is a hope that we may be able to prevent this catastrophic consequence. That is why this was planned.
So 3 disappointments for the family. They said, let's do the surgery the 4th time around. You wanted to make things happen. You've planned something which is nearly impossible. Heart surgery is tough. Balloon dilation itself is a complicated process. But here, you're going to perform the surgery on a child or a baby who's in the womb of the mother.
Yeah, that is where the challenge comes. But fortunately, we have the expertise where we have done a lot of fetal medicine procedures have been done by the fetal medicine experts. That means when the baby is in the mother's womb, a lot of sampling, a lot of injections, a lot of testing, all those things we have been doing it. But this is the first cardiac intervention that we have done at AIIMS. But we have done a lot of neonatal procedures. That means once the baby is formed, even in preterm neonates, we have already done in few grams babies also we have done procedures. So we have the expertise in doing either way. Like we have done it a lot of other procedures in the fetuses, and we have done quite a lot of procedures in very small neonates who are born day 1 of life, who are preterm also. We have done quite a lot of procedures. So that kind of an expertise, what needs to be done, was there. But then this is a special challenge because it's almost it's a kind of, the heart is kind of a one grape-sized heart.
Yes.
That grape is also not near you. It is it's well protected inside the mother's womb, inside the baby's chest wall. that is there. And then we have to enter that grape and then pierce through the hole of the grape which is actually getting closed. So now we have to come out in the right place and then do the ballooning. That was the challenge.
Wow. But was there a time window that you had to operate on? How critical was this entire timeline? Why this rush to finish it in 90 seconds? Explain it to us, please.
So, like for example, once you enter the ventricle, immediately the heart stops or immediately the heart becomes slow. The same thing happened in this baby also. Had we taken more time, initially we gave some injection, there is a response. But if you take more time, then that response goes away. The heart stops forever. So that way we have because we are actually perforating the apex of the heart.
Yeah.
So it cannot tolerate it. It will not tolerate. Body will not tolerate this kind of a thing forever. So that time is very critical. So we had maybe around a maximum of say around 120 minutes to seconds, 120 seconds to go in, finish the job and get out. So we were able to do it. We thought we have taken more time, but then we realized actually when you look at all the clocks, then we actually finished it in 90 seconds. So that was that. But for that 90 seconds, we need to practice. It's like a 100-meter race where a sprinter practices for decades to get it under 10 seconds. The same thing we practiced for. We did mock drills in our minds. Really did the procedures in a mock environment, and then recreated everything. And we are prepared. We had a very good team of fetal medicine experts and anesthetists who controlled everything. So everybody knew what they have to do. So that the guys who are doing the procedure, they are on the procedure only.
No, phenomenal work by you and your team. I know it would have taken a lot of coordination and effort. The prep work, you've never done this before. So no matter how much of the simulation, when you go in, it's got to be the first time. But I'm very curious. Please tell our viewers, how are the mother and baby now?
So it's been more than a month now since the procedure has been done. So we actually waited for the results to come out before we get this out, because we do a great procedure and the outcomes are not great, then we should not be reporting it too much. But now still that valve that we opened is still functioning.
Wow.
And there is a mild leakage is there. That means the valve is open and valve is functioning.
Phenomenal.
And the ventricle, the main heart chamber that I'm making, that becomes smaller and smaller. It's no longer that small and it is slightly growing with
That's
time.
welcome.
So it is not shrinking. Otherwise it would have shrunk by now and it would have become non-usable by now. So but things are on the right track. So hopefully once the baby is delivered, then still the baby will need another procedure. Like once the baby is born, the child may need a balloon dilatation again. But this is a different balloon dilatation that we are quite used to, that we have been doing it for. We do roughly around 15 balloon dilatation, more than 50 in a year at AIIMS, such in children.
No, phenomenal. From taking a call that was a never before, to saving a life, and then to wait for a month to just ensure that the effort has paid off. It's phenomenal effort by you and the entire team at AIIMS. Kudos, congratulations. Thank you very much, Dr. Ramakrishnan, for speaking with us. Thank you. And with that, we call it a wrap on this edition of The Right Stand. On that happy note, ladies and gentlemen, stay with us. Brass tacks after the break.